make people aware what they are going to have it for next few weeks or months, maybe. Yeah, let's see.
Yeah. It can very well go beyond 21 days. So
definitely it will be. There is no doubt about it. We do not have any doubts about like what we discuss every day about most of the countries in Southeast Asia. I know I'm from India. I've spent most of my life there. I know the healthcare system. I know the people, the crowded, the density of the population. So it looks very scary at present. Let's see. Let's see. And the reports of WHO, like we are still hoping, most of the Indians, like as I'm seeing from my social media messages from my friends, that they're hoping when the summer kicks in, it might get us in a better position. But WHO is denying that at present because no one has seen hot and humid conditions at present with this virus. Yeah.
You're right. So elders have started joining. We'll just wait another 1 minute and then we'll carry on with the session.
Yeah.
Namaskar, Arun ji, Shiraz ji, Manisha ji. Hi, Ritu. I hope my voice is clear to everyone. Welcome to another Doctor Talk. And then I think we're starting in 1 minute, next 1 minute. And elders will keep on joining. Good morning, Colonel Puri. So I hope everyone is happy, healthy, enjoying their lockdown time period. New activities.
Yeah.
Couple of positives.
Everything is okay.
Yes, couple of positives that I can see is the air pollution has gone down. We can now see stars and remind back in Jammu. So it was very good. I hope it stays the same way. I can see Vinita ji out in the garden. Good place to have this session. So we have like 800 people now positive in India. The increase in number of people is not, has been flattened a bit, not like the exponential increase that was happening. So let's be positive about this. Stage 2 or stage 3 for us, it's the same. We stay inside. Prevention is everything. We don't want to get exposed ourselves with this virus. We stay inside. People say it's stage 2 or stage 3. For us, everything is the same. The precautions जो हर दिन आपको बताए जा रहे हैं वही लेने हैं, उसमें कुछ नया नहीं करना है. Today there is a good news that अब हिंदुस्तान से हम बाहर जा रहे हैं आज. मेलबोर्न में बात जानेंगे कि डेवलप्ड कंट्रीज में क्या चैलेंजेस आ रहे हैं, डेवलप्ड कंट्रीज में गवर्नमेंट क्या एक्शंस ले रही हैं, डेवलप्ड कंट्रीज में डॉक्टर्स को क्या इश्यूज हो रहे हैं और उनका लाइन ऑफ ट्रीटमेंट मैनेजमेंट क्या चल रहा है. ये सब बातें करेंगे हम डॉक्टर राहुल जैन से. डॉक्टर राहुल जैन क्वालिफिकेशन से पीडियाट्रिशियन एंड न्यूरोनेटोलॉजिस्ट हैं. CMC लुधियाना से इन्होंने अपना पोस्ट ग्रेजुएशन करा है. हिंदुस्तान में 6 साल इन्होंने प्रैक्टिस करी है. फोर्टिस जैसे रिप्यूटेड इंस्टीट्यूट के साथ इन्होंने काम किया है. अभी वो ऑस्ट्रेलिया में प्रैक्टिस कर रहे हैं और आज gratefully we are grateful to Dr. Rahul Jain that he has volunteered to join us for today's session. Dr. Rahul Jain हमारे साथ है. Now I'll request Dr. Rahul Jain to take over. Dr. Rahul Jain will speak for some time, and then afterwards you can ask him questions, queries, whatever you have for him. So over to you, Dr. Rahul Jain. Welcome to Mo TV.
Hi, good morning, everyone.
Good morning.
Have a very bright morning, I think so. Yeah, it's getting better in India, weather-wise, not everything else. So today I've been asked to talk something about the most dreaded pandemic we are going through of our times, which we haven't experienced in the last 100 years or so. We are all actually new at it. We are all learning. Even the developed part of the world is still trying to find its own ways to halt this pandemic. Not very successful, though, sadly. There are many different reasons to that. I think you must have heard a lot about how it originated, where it came from. If you want to have a little bit rewind of that, I'll just start with that. Why do we call it a coronavirus at first? It's not the first coronavirus we have seen actually. It's called corona because it's a crown-shaped virus. When we look at it in the electron microscope, it looks like a crown. It's not the first one. We had some outbreaks before. It was, thankfully, they were not big pandemics. It happened in 2003, 2012, 2015, 2018, but they were known by different names except for the 2003 one, which was SARS-CoV, and it caused only 774 deaths. And then it came back to us by the name of MERS, because it was just contained in the Middle East part of the world, but it claimed death around 400. And then it again came in 2015 and by the same name, but it happened in South Korea, but it was contained there. But this one, which have started in Wuhan city of China, which is just, we are presuming it to be the outbreak center. It has led to a big chaos. It started in December actually. Why this coronavirus actually is more dangerous, or I would say, is it causing more infections, or it's more deadlier? There are few thoughts behind it. Once it's spread, the spread of this virus is pretty quick, and the main reason behind it that it's not acting like any influenza virus, which we usually get in winters if we just have some common cold and flu. If, for example, if you have it, I get it from you. After 2 days, I'll have some cough, cold, fever, and 5 days I'll be all right. But with this virus, the main problem is that we remain asymptomatic. There are no symptoms for like 7 to 10 days sometime. And for healthier population, it mostly says mild cough, mild sore throat, or even a low-grade fever. So they remain undetected and they do not come up and isolate themselves. And then they go on and keep infecting others. And the other reason of transmission, it's not only the air droplet transmission. Air droplet transmission means if we sneezes, if we coughs, from our cough, there are some air droplets generated, which remain in air for some time, and then they get suspended and go to the ground. So that lasts for only few minutes or few hours, I suppose. But the problem with that, it stays on the surface a little longer. And there are very conflicting views regarding this. Some are saying there stays around 12 hours, and some even predicting that it stays for some days as well. And they have tested on different type of materials, on metals, on wood or everything, but yeah, it stayed there. So that's the second reason why it is getting transmitted, because even if someone has touched his hand somewhere, an infected hand basically, with his secretion somewhere, and someone comes and do the same thing and just put that hand into his nose, ears, or eyes, then he starts getting this virus. So that's another thing we need to understand, why we are more bending towards hand hygiene and cleaning our surroundings, especially wiping our surfaces, our doors, our appliances, our switches, because you never know, it stays there. So hand hygiene is the most important thing what we have seen, which helps in preventing the transmission of this virus. And yes, the mask. Yeah, the mask is whatever it's available in market. I'm not sure what's available in India, but yes, there are two types of masks basically. One is a surgical mask, which is actually a layered surgical mask, which is not that easily available. And the other one is N95, which is rarely available. These two types of mask helps to prevent the transmission for some time, but most of us in general public, or it just gives us a false sense of security. That's why wearing a mask and going outside and playing tennis, talking to someone, having parties, it's not going to help any prevention. It's the main reason when people have some false sense of security and they say that, yes, I'm protected and I can go out. Okay, so I've talked about the transmission. Incubation period is the period when you have a virus inoculation in your body and you start showing symptoms. Most of the studies and most of the learnings which we had about this virus, they say it's 2 to 14 days, which is actually longer than the normal viruses. But some studies suggesting it lasts a bit longer than that. But yes, there are some reported cases when people have experienced symptoms up to 27 days as well. Need not to talk much about medicine here, that how it goes, but I'll just give you a small idea. Once it enters our body, it goes into our nose. Through the nose, it goes to our windpipe, where it stays and produces some reaction. Our body reacts to it. And there is some mucus production, I would say, and which will block our airways and also the air exchange alveoli, which are the exchange point where we where we exhale the carbon dioxide and take the oxygen. So those are the terminal structure of our lungs, which gets blocked with this mucus, and then the hypoxemia, I would say, the respiratory distress or shortness of breath will start. So that is one of the reasons why people in later stages are getting more critical, because with our advancement of age, one, our immunity decreases, there is no doubt about it. Secondly, our capacity of the lungs gets lower, and our capacity to keep it expanded is a little bit lower than the younger population. And also there is a mechanism of expelling out this mucosa from our upper and lower respiratory pathways, which are very small thread-like cilia. They also, with the advancing age, they also decrease in numbers. So the mucus stays for a longer time and it causes more problems. People have talked a lot about symptoms. We are still not sure what is the first symptom. We are saying that fever is the most important one, but have seen cases which are just experiencing 99 fever, 99.5 fever. Some are saying dry cough. Yes, it is one of the most important reason, but people sometimes just have mild sore throat. I'll give you my example. In Australia, what they have done for healthcare workers, for doctors and the other people who are working, who experience even one symptom, they have to get tested. So 2 days ago, I was just feeling perfect. I started having some mild tingling in my throat. I talked to my consultant head. He said, yes, you have to get tested. So I was kept out of my job for 3 days, though my result came in 1 day, just to make sure that I do not infect anyone else. And thankfully, they were negative. In India, government has made very clear guidelines. What I was reading on one of the Indian health website, that whom do we need to test or whom do we not? That's a very important thing to understand. There are not many available kits at present. If we keep on testing everyone, and it's not going to last more than 2 days maybe. And thankfully, Indian scientists in Indore somewhere has produced their local kits, which has been approved by ICMR to go ahead with it. It says that it's going to detect it in 3 hours or so. Usually, if we run through a lab, a normal test which is available to other parts of the world, it takes around 7 to 8 hours to get a result. So it's going to be a little cheaper. It is going to be a mass production of that. Indian government is working very hard on it to bring it in the market. That's what I've just seen on one of the websites, on the Indian health websites. That's a good news in a way that we are going to test many more people, which is very, very important, because if we do not test people, we will not know where are we actually. At present, the numbers are 800, which seem to be pretty much okay. That's all right. That's like any other infection. And if you see India would be having more typhoid cases or cholera cases or maybe other cases rather than COVID at present, if we just put it in numbers. But are they right or not? Nobody knows actually. We haven't tested many people. In the last 2 months or so, many people have. Yes. Hi. Yes.
Dr. Jain, can I just
Yes.
request you to move away a little bit from the mic? There's too much of echo coming and we can't hear you clearly.
Is it okay? Is it better?
Are you in earphones or some speaker kind of a thing?
I'm on laptop. Is it okay now?
No, there's too much of echo going, so I don't know how clear the thing is.
Okay.
Can everybody...
Is it okay if I change my position? I think I'm sitting in an open place. I'll try to move to the place.
Sure.
Little better.
Little better.
Little better? Okay.
Yeah, sorry to disturb.
That's okay. That's okay. If you are not able to hear me, there's no point talking about it. Okay, so we were at like what symptoms, what we should be worried about. Are you able to hear me, guys?
Yes.
Okay. So fever, cough, sore throat, and some dry cough, which usually is seen with any other illness as well. Then there are reported cases that headaches and more myalgia, body aches, is seen with COVID. These are only the mild symptoms, or would say people who can have that and then will get over because of their immunity. But then there are some dreaded complications, leading it to pneumonia, critical care, and ending up in a ventilator. It happens. The age groups, which is very important for us to understand, we have different age groups. Like India, though, is a very young country, but still we have a very major proportion of our elderlies with us. And it's not about our own health or their health. Is actually, if younger population will not follow the protocols and will not keep social distancing, it's not about they must be thinking that yeah, it's not nothing gonna happen to me. It's just common cold and cough. I'll be all right. But no, there are some reports. There are some cases which has been seen from 30 to 40 years of age. There was a staff in UK, 36 years old. She unluckily demised. There was a 34 years old radiologist in Philippines who didn't have any comorbid conditions. He couldn't make it. So there are some examples coming up which are showing that it's causing critical illness in the younger population as well, though the numbers are not very high. WHO has made many guidelines for when to get tested and when not to get tested. I have found a very interesting site, maybe you are more aware of it in India. It gives us all the information what we need to know about India and WHO, and it's a very interactive website. You can learn a lot about it, that do you need to go and test or not. If you can write it down, it's a very good one. It is health info. If you know it about
Doctor, maybe you can share your screen.
Okay, so I'm not sure how to do that. I'm not a very tech savvy guy.
What's the website?
Next time, don't worry about it.
Let me share.
Yeah, it's a trueinfo.health.
Okay.
Trueinfo.health. It will give you all the guidelines which you guys need to follow, which your relatives need to follow, and it also has a very good guidelines for healthcare workers. Now about the age groups, you must have heard about it a lot, that people who are in their 60s, 70s and beyond are getting affected a lot. Yes, it does. It is becoming quite a headache in this population. It is causing more dreaded complication. But that does not mean that everyone who gets this COVID infection will end up dying. It's not the case. If I just put it in numbers, of all the cases till now, beyond 50 to 60 years, it's around 2 to 2.5%. It's reaching around 3% now. More than 60 to 70, it's coming around 5 to 6%. After 70 years, it's 10 to 15%. See, but that numbers, the mortalities happen in those age groups. They had many comorbid conditions. Some of them had cancers. Some of them were very immunocompromised. Some of them had comorbid conditions such as hypertension, diabetes, and other problems. Yes, if you have any other comorbid conditions such as diabetes, hypertensive, or chronic cough, or has any chronic problem for which you are taking medications for a long time, for you guys, it's more important to follow the restrictions, or I would say social distancing, rather than younger people. But yes, younger people, if younger people won't do it, then we will never achieve what we want to achieve by the end of this August or September, which we are predicting or hoping it to end or even get better. So I was earlier talking about what do we do in Australia. At present, it's not like in India. We have more cases than India, 3,500 around, and every day we are adding up 200 cases. But these cases are mostly which people have come from abroad or had a direct contact with those people. So local transmission is very low at this moment. Australian government or the Western countries, I suppose, have not done the lockdowns like India did, because there are many things. For example, in Australia, most of our healthcare workers are dependent upon the crutches, are dependent upon the kindergartens where their kids go so they can come to work. And that's why one of the reasons they didn't want to close it so early. At some point of time, they will, to keep everyone running in some point of view. And since people here are covered with, government has covered them with medical health, as well as they're also issuing them packages of money per month, the people who are residents and who are citizens. So it becomes a very big financial burden for the government to handle, which at present moment everyone is surprised that if they are not going to provide that. It's only a week or so that they have become stricter. 2 weeks ago, everything was almost normal. Just in a way, there were some public warnings like just keep a social distancing. At the moment, the supermarkets are open, small businesses are open, public transport is still running, hospital healthcare definitely has to run, and but everything else for entertainment and outings has been banned. As I go outside, I see lesser number of people. And people here, even if I go to supermarket to buy something for myself, from the last 2 weeks, I would say no one is just standing very close to each one. They're just doing it by themselves. Maybe because we have lesser number of people here, and yes, that's one of the reasons. Even if I go in metro, we do not have so much people. They're sitting far away from each other, or even if they stand, they're little far. I went to central Melbourne, the streets which are pretty busy. 2 weeks ago, yes, they were almost, or I would say like 70 to 80% of what it used to be. But people were trying to keep the social distancing, not very effectively though. But now they're deserted, like everything is closed down, all the entertainment industry, the hanging out places, everything they have shut down. People are inside doors and they're coming out for essentials. But yes, there are still small businesses, I would say, like car washing or small stores like 7-Eleven or McDonald's, Subways. They're doing more of the takeaways now, and the restaurants have been ordered not to do any dine-in. They can do the takeout orders. So these are the things which they are slowly making up. For us as healthcare workers, as compared to what Indian doctors are going through, I would say it's a very big difference. Definitely because of the resources they have, and also the less number of population or people coming up at our doors. It's nothing like India, trust me. They have made very good plans for us. They have separated our emergency departments. They have stopped all the outpatient departments. Nobody is allowed to have any OPDs. We are doing teleconferences. If any patient wants to have a advice, we have my hospital has made a platform where I have to interact with them via video conference. And if they need to come to the hospital, they'll just come up in the emergency where their triaging is already done, that for anyone with respiratory symptoms or fever, they'll go to the one side and the other one will come to the other side. Hospitals in Australia as well, they do not have much capacity if it gets very worse. They are building new ones, they're building new departments, they're converting all the elective things to the dedicated corona ward now. Also, I was just about to say, like, all the elective surgeries and all the elective procedures has been postponed indefinitely. Like if someone wants to have a knee surgery, someone wants to have, which is very elective, which can be done down the line. They have been they've been all cancelled now. As a healthcare worker, every day we go, it's becoming tougher and tougher. And there are cases that people who are working in these wards, even with the full equipment, they are still getting infected. In Italy, from which the world actually is learning a lot, 1 in 10 affected patients are doctors or healthcare workers. And that's the scenario actually. In India, if it happens at that scale, we are very scared because we do not have proper governed systems. There is no single body who make the guidelines and everyone follows it. We have many small nursing homes, we have many small hospitals running on their own, making their own guidelines and buying their own stuff, and we are not pretty sure if it breaks out how India is going to handle that. But despite that, India has done pretty well by locking it down, which we are presuming is not going to stop it or finish it, but it's buying us time. I mean, Indians, it's giving us some time so that we can get prepared for when it comes full blown. So it's 21 days, guys. It's very difficult. I'm living here in Melbourne alone. My family was supposed to come here. They are back up in India. They cannot come. They cannot travel. It's very difficult. Every day I talk to them. It gets mentally tough. In Australia, they have made a special hotline numbers for people who are having some depression or something like that. But I'm not sure India will be up to that mark for this time. So all we have to do to just hold on to each other in our home and just let this time pass. If you stay in the house, you are helping everyone. Actually, you are helping everyone. Regarding use of home sanitizers, people have hoarded sanitizers all over the world. It's not available anywhere now. And people have many myths about this disease, that if we do this, that's going to happen. If we do this, it can be halted. No. WHO has busted these myths in their one of the publications. One thought which we are having, that India will enter summers in mid-April, late April, and then this virus is going to get killed in heat. There are no proven studies that it will. WHO says it will be transmitted throughout summers, even in hot and humid conditions, but that is just a prediction. So back in my heart, I'm also hoping it to stop, because this virus has easily survived in us human bodies, which is our normal body temperature is 36 to 37 degrees Celsius, so it's surviving very normally in that. So that is one myth which I'm not sure it's going to help us in some way or not. Nobody knows actually, but WHO says that it does not have any effect on this, which is not a very good sign if it happens. Then there is another myth that if we take a hot shower or a hot bath, it will go away and it will help us in getting rid of this. But it's not proven. You are not going to take a bath with like 60-degree hot water. At a normal body temperature, it's going to survive. If you are going to take very hot showers, it's going to harm you. Your skin is going to get more vulnerable. So I think it's not advisable at present to have a very hot shower. Yes, You can use the normal temperature or just mildly above that, which usually you used to do, which is appropriate for your skin. So there are no skin infections or no skin disruptions, to minimize any discomfort to your body. Just use a normal temperature or the temperature which your body is used to it. There were some people who said, if we wash your hands and we hand dry it, it's gonna kill. No, actually it's not right. It's all about how you wash your hands and how long do you wash it for. The recommended time is around 20 seconds, which, trust me, is not a small time. It takes 20 seconds, sometimes longer. You feel that 20 seconds have not gone yet. Yes, there is a way of doing a hand washing technique. You can see it on the YouTube, how to do a hand wash with the soap and water. If you have a good sanitizer at home, you can use that as well. But it has to be done in a proper way. And if you're washing your hand with soap and water, it's better to dry them with a paper towel rather than hand drying it or using a single-use towels. Right, it's better to use a disposable tissue, that hand towels, paper towels. Then there are some thoughts regarding, if we spray some alcohol on ourselves. I'm just talking the questions which actually has come up. People have thought that if we spray ourselves with alcohol, we are going to get sanitized and it's not going to happen to us. No, it's not true. It's actually not recommended at all. So please do not do that. Do not use any hand sanitizers or anything with high alcohol content on any other part of your bodies. It's going to cause more problems. Then people tried many things. They used ultraviolet lights to kill it, but it didn't help. And now about the most important question, which everyone even the health professionals are pondering, that will there be a vaccine? Yes, or maybe not, because the whole world is trying to do that. There are 35 dedicated laboratories around the world who are working on it. Some have claimed to make it, but it's not about making a vaccine, actually. It's about how are we going to introduce it in the market. Because if we see how does a vaccine how earlier vaccines have come, it usually takes around 3 years time before it comes in the market, because it needs loads of sampling, loads of tests, loads of post-immunization side effects, and what is the dose we are going to do. So WHO and in US especially, they have fast-tracked it. And if it does not meet any hurdle, they are suspecting it to be 14 to 18 months, which I want to be earlier. I'm wrong. I hope I'm wrong, but that's what we are discussing here. So it's not going to be near anywhere. So don't wait for any miracle to happen. It's only us who are going to stop it. Then there are some, I was reading one article, they said, take garlic, which is very healthy otherwise. It has some good antimicrobial properties. WHO has discarded that as well. It does have some antimicrobial activities, but it's not going to act antiviral. Then I think around a week ago or 10 days ago, there was a lot of talk about malarial medication, anti-malarial medication, hydroxychloroquine, which helps in halting this virus. Yes, in vitro and in vivo, means in the lab and also in human body or animal bodies, we have seen it slows down the progress. but it does not mean that everyone is going to take that, because it also has its own side effects. If we keep on giving it to everyone who even doesn't require it, it's not going to help. It has helped only in mild and moderate cases. They have no written or they have no proven thing as yet that it has cured someone. There are 2 cases which was reported from SMS Hospital, Jaipur. So I'm answering, yes, if I'm not mistaken. They treated a patient with different medications, antiviral remdesivir, which was earlier used for a coronavirus, and then they did with hydrochloroquine and azithromycin. Luckily or unluckily, 2 patients got cured. One later succumbed to his problems because he actually had too many comorbid conditions. So it's not proven as yet. There are a lot of trials going on. There are no strict guidelines as yet. So do not do that which is not recommended as yet. So Indian government has started hydroxychloroquine for healthcare workers. Maybe they have started it. Healthcare workers who are going to work in the ward with proven positive cases. It's not for anyone else who has not come in contact or has not stayed near COVID cases. So do not take hydroxychloroquine on your own. Talk to your doctor, tell him your symptoms, tell him if someone has got positive case in your home or in nearby your home, or you have visited a place where there was a case. So stick to that. Do not take it on your own. I know it's very easily available in India. I'm not sure if every counter is empty now, but we do get all the drugs without a prescription in India, which I'm afraid it's not the same here. So Australian government has given a lot of thought about it. They're still in the preliminary stages of thinking or implementing hydroxychloroquine or not, because they're still waiting for all the trials to get over and WHO recommendations. At present, we are not taking hydroxychloroquine. Anyone, not even an Australian citizen, not even Australian doctors.
Dr. Rahul, wanted to ask you, just on those lines, आपने देखा हिंदुस्तान की गवर्नमेंट की guidelines or restrictions, and आप ऑस्ट्रेलिया में हो, you know what that government is doing. I wanted to ask, what are the differences and similarities at government level in terms of the approach, and what do you think we should learn from Australian government and do in India as well?
Honestly speaking on that, there are very different views about that. Since this is a new thing, everyone is following someone, and the other one has already fallen in pit. So Australian government or Indian government are acting in according to their in demographics. Basically, we have only 24 million people living in Australia. So there are few areas which are densely populated. I would say Melbourne, Sydney.
The person you are speaking with has put your call on hold. Please stay on the line.
I'm sorry. Hello.
Yeah.
Yeah. So there are only a few pockets where there is some density of population. Otherwise, Australia is so sparsely populated, I would say. There are big suburbs. There literally you can see one man after a kilometer at some places. So Australia has acted in that sense. So they have not restricted much. They knew that this is going to happen. They started bringing down the restrictions steadily and slowly so that people get accustomed to it. And also, people here abroad has different sense of understanding about how their life should be. So they're more demanding. They have more rights here. They're more. If they say that I want to go out, they will go out. But Australia in the last week or so has increased restrictions, and they are increasing it day by day. They have not done it in a single day as Indian government has done, but Indian government has its own set of problems. They know that they cannot teach everyone. Honestly, it's not going to happen overnight. And what we feel here, what I think also, that if we have bought these 21 days, because this is not the time where we can just sit back and say that, oh, 21 days are going to be over, everything is going to be fine, bright and shiny. No, it's not going to happen actually. These 21 days are for us getting prepared, the health system getting prepared for all these sick patients who are about to come, and Indian government making their base camps in every small nook and corner where they can teach people through simple methods, through the Anganwadi workers, through the ASHA workers, so that they get a hold of this thing, because they had to do multiple sessions to make anyone understand that there is no cure. There is no jadoo, koi jadoo nahi hai. It's all about common sense and social distancing, and it's not going to happen so easily. So my humble request to everyone here, supposedly if you're living in a family and someone from your home has to go to work and has to go outside, so I would request, if whenever he or she comes back, keep the door open. Do not go and open the door for them. Let them come inside, go straight away, go to the washroom, change their clothes, have a good wash, had a good shower, come out and wear different clothes, and wash those clothes. Put it in a dedicated basket where all these clothes go, or put it in a washing machine whatsoever. And the doorknobs, which you are going to use frequently, and we do not have the habit of remembering it. If you have a sanitizer at home, that's pretty good. Clean it. It takes about 20 seconds of wiping to clear that thing with alcohol-based these things. Otherwise, you can do it with a normal soap and water as well. If you have to meet someone, try not to meet him. Do the video conferencing, do the WhatsApp calling, stay away. In your family, if no one is infected and you're inside, you can have close contact. That's not a problem. And you can go to the gardens as well, but like that's what we've been told here, because the gardens are many and people are very few. So even if we go outside, we're not going to come in contact. But yes, you can be in your home garden. You can be on your terrace, as Dr. Baba was there last night. So you can enjoy the environment, but it's not like you have to just lock down yourself. You can go to your balconies. Just it's the human contact you have to do. By example, I would say my parents are living in Punjab. So they live in a gated colony, and Punjab government has implemented curfew, so no one can actually come. What they have done, they have distributed the local suppliers' phone numbers to everyone. The milk guy, grocery guy, medicine guy. So they just call them, they drop the things at the doorstep, and then they pay them. They do not have contacts with them. So that's the more of a thing which we are going to experience in next 3 to 4 months, I suppose. It's not going to last in 21 days. I'm afraid so. I think that's about it from my side. If you guys have any questions, I'll be more than happy to answer that.
Yes, Mr. Roy. Yes, Mr. Roy. पूछिए अपना सवाल पूछिए.
Yeah. one question, friend. If we have to go out, say, weekly once for patients, is it better to wear gloves, rubber gloves, so that direct skin doesn't get affected and come back and open and throw that gloves? Is it better?
सर एक बार फिर से पूछिएगा सवाल, वो आवाज थोड़ा कट के आया था.
What I mean is, if somebody has to go out maybe once a week, the rations, whatever the month, groceries and all, is it better to wear rubber gloves and go out and do all your purchasing, come back home and throw the rubber gloves back into a garbage or whatever? Is it better? Then would you avoid
it's not recommended.
because your skin?
All right, I'll answer that. It's not recommended. There is a very simple reason for that. It will definitely give you a false sense of security. That's what I've talked about. Even if it's your hand or your gloves, if you touch anything, the outer surface definitely is going to get infected. And the studies have shown if we use half measures, and it makes us more complacent. And we forget that actually we need to follow all the precautions. We might touch our ears, we might touch our nose, eyes. It can happen because your mind is not thinking that. You think that your hands are secure now, but they're not. Now these gloves, you're going to use it, you're going to put it in your hands in your pocket, you're going to lift all the essential items with it, and you're going to touch it at different, because you'll be so fearless, you'll be touching it everywhere, and you're bringing so many things to your home. It's better not to do it. Honestly, it's really good if you do not step out for some time. Try to bring all the essentials at your home. If someone drops, for example, vegetables at your home, pick up the polythene properly and wash all the vegetables properly before using it. And then use hand washing is the most important thing. It is. There is no doubt about it. So do not use anything which gives you partial thing. So just go full blown, do the full social distancing, and do the full hand washing. Treat anyone whom you have not met as a COVID suspect. So your mind is always switched on that you do not do these mistakes.
Okay, thank you.
Okay.
Yes, विनीता जी, आप कुछ पूछना चाह रहे हैं?
Newspapers. We get newspapers. Do they need to be disinfected? And how? Number one.
Honestly,
Second question is that since Dr. Jain is from Melbourne, my son lives with... Hello?
Yes.
Hello?
Yes.
My since one question was about newspapers, if they need to be disinfected, and two, since you're in Melbourne, my son lives in Gisborne, which is a small town outside Melbourne. How does the virus and the precautions, etc., affect them in the smaller towns?
The transmission in the smaller, I'll switch to the second question first about the Gisborne.
Can you hear me? No.
Yes, can you hear me now?
I've gone off.
Miss Vinita, I can hear you.
Hear you.
Yes, I can hear you. So about your second question, your son living in Gisborne, it has not gone very far from the main central areas as yet. There are some reported cases in the regional hospitals, as there were only 2 cases. So whatever the guidelines we are going to follow in Melbourne or Sydney or Brisbane, it's going to be a DHHS guidelines. So ask your son to log on to a health website which issues guidelines every day, twice a day sometimes, for everyone. So ask him to log on to a district health website, and he'll get all the queries for himself. And about the newspaper, honestly,
And the newspaper? What about the newspaper?
yeah, honestly, we are not using anything of that sort here. But going by everything, yes, it's a paper, so it needs a disinfectant. Or can we just avoid it for some days to have it in our home? We can read it online. Is it okay?
All right. Thank you. Thank you,
All right.
doctor. God bless
Okay.
you.
Thank you
God
so
bless
much.
you.
Thank you.
कर्नल पुरी आप स्माइल कर रहे हैं.
These programs that come, excuse me, I want to ask
Yes.
a question. Today is my first day on this program. If I have missed earlier ones, like yesterday or before, are there any recordings that I can get back to and go through them?
Well, for this, I'll just answer you, Mrs. Vinita, that
Can't hear me.
we are trying to put these on YouTube subsequently, but as of now, like though we have some recordings, we can try to send them to you. But I'm not sure if that really works. But the moment they come on YouTube or something, we will get back to you on it.
All right, thank you. I have a net problem. It's going.
Any other questions for Dr. Jain? He's with us from Australia.
Please thank him for taking all the trouble.
Sorry?
Thank him for taking the time.
All right. So I think, Dr. Bawa, we can just thank Dr. Jain for being here with us and talking to all our elders. He's taken out time for us. A big thank you to you. And it's really a privilege that you could, talk to our elders here and, let us know about these two different things that you were talking about what is happening in Australia as well as in India. And of course, COVID updates are always welcome. Though it's an everyday topic, but any input, I think it kind of, soothes us and kind of keeps us to tells us to keep calm. So thank you so very much. And I think Dr. Bawa can just conclude and finish. And thank you so much, everyone, for joining in. Yeah,
Is Dr. Soumik Kaleta coming today for any program?
Not
Dr.
today,
Soumik
ma'am. He was with
Kaleta?
us. He was with us yesterday on this platform. We will try to get him again and inform you before in hand when he's gonna join.
Yeah, thank you. Can I get yesterday's recording? No.
Yes, we're working on that, ma'am. It will be on YouTube soon. We'll share the link with you.
Achha,
As soon
thank
as we get upload on that.
Thank you. I'm 83 years old. I'm a widow and I live on my own. And I'm not tech savvy. So I have a problem with all this.
I hope you could hear Dr. Rahul Jain clearly.
Yes.
Yeah.
Yes,
And we have another session around 4 o'clock where a dietitian speaks. And then we have an entertainment session at 6 o'clock in the evening. Morning 8 a.m. we have a physiotherapy session. So please request you to join us. We'll keep you entertained the whole day. We'll thank you, ma'am.
God bless you all. God bless you.
And thank you, Dr. Rahul. It's a pleasure having you at this platform, sharing your thoughts with us. Very privileged because of the technology. And we would request you, whenever you have time in future, you please join us again. Thank you, everyone, for joining us. Thank you so much, Dr. Rahul.
Yeah, thank you so much. I just want to say one thing. Thank you so much. It was a pleasure for me to just seek your blessings for us doctors, healthcare workers, all to fight this dreaded pandemic. Thank you so much and take care. Stay safe. Stay home.
Okay, elders. Namaskar. Join us again at 4 p.m. today in the evening. Thank you.
नमस्कार नमस्कार सब ठीक रहिए सुरक्षित रहिए be safe
Thank you, ma'am. Thank you.
be safe God bless
You too.